I really loved how to see that all of the cases we heard in the previous presentations, that it all connects to patient centricity as well. We heard about the end users and the patients on measuring their vital signs, also simplifying user interface for their use, also co-creation by kids with kids, and also seeing how the workflows can be changed by thinking of the prevention perspective. And to dive deeper into the topic, I want to share something. So in 2003, World Health Organization made a report on the results on patient adherence, and said that there's basically epidemic of silent medical non-adherence. And the data was that 50% of patients with chronic diseases did not adhere to their treatment, 50%. And now we have all kind of wonderful digital tech solutions coming in, AI chatbots, all kind of reminders, digital diaries, and more. And I would like to think that the data has improved, but in fact, it's still around the same 50%. Of course, we can think that technology will still take some time to be adopted and to show an actual big impact in this. But this is the question that I'd like to raise and have a bit of discussion right now. What are the things that we have to change to actually increase the adoption of the tech that we're building, and also to making it like long-lasting for patients to use, not only patients, so we can actually also see the impact of it, also in adherence, but in general, like in the use of it.
Yeah, maybe I can start. So I think there are like multiple problems with the adoption. I think at the moment we are in a way, we have a situation that there is the way how the clinical healthcare world is working, and then there is a massive amount of different new technologies and opportunities. They are different worlds. And one problem is that if you want to improve the adherence, so I think improving the adherence is to bring technologies that people can see the feedback loop actually happening. But the journey to get a new technology being integrated as a part of the healthcare workflows is extremely complicated. And I understand very well why, because the clinics, the hospitals, the healthcare system, the healthcare professionals are like, they are burdened with the pressure that is coming just to keep the current workflows going. Then a technology company comes and says, oh, you should adopt this in your workflow. Of course, it always feels like, oh my God, we are struggling to kind of to manage in what we already have. So I think the kind of the solution would be like for technology companies to figure out as well as possible how you don't make a mess when you bring the technology to the healthcare.
Yeah, let's start with that, not making something worse.
Yeah, but it's a complicated thing. So I think it's a lot about collaboration, but so that I think that's the kind of the problem in adoption. Like, how do you make these two different worlds to connect? How do you adapt something to a system that it's already struggling?
And is there maybe from your experience something that we can do more from designing perspective and designing the services as well to make these technologies to create the impact that they're meant to? Vili, I think you wanted to say something.
Yeah, so now, of course, you know, the companies and technologies that we specifically on stage are building, you know, we are more on the diagnostic side. Also, obviously, there's that disclaimer, but I very much believe that there could be a lot that could be achieved with, let's say, relatively even low technology solutions, not to even dream of the high technology solutions. But I think that a lot of these sort of failures to, you know, keep people informed that yes, you need to keep taking your medication. Yes, you have a chronic condition. It's not going anywhere. You know, you have a prescription for a year or two, and then many people stop taking them at that point because they don't realize that this is a lifelong medication, but you need it. Actually, it's like the maximum duration of a prescription is 2 years. For some medications, 1 year. So many people don't recognize that it's not, you know, a 2-year course and then you're done. So I think that many things, especially with the help of technology, could be improved if we actually manage to break down some of the barriers that stop us from utilizing data that already exists in a silo somewhere. Because, for example, the pharmacy knows whether you have picked up your meds. No, Kela knows whether you're picking up your meds, but your doctor doesn't. So there's a lot of things that could be automated. We could provide feedback. We could integrate the results of this treatment with the fact that are you using it or not, to automate also reminders, follow-ups, if necessary, interventions. And I do exactly share this idea that you need to know what's the situation. Is the person in need of treatment and are they using it?
So it's a lot of integration problem. Like if you adapt some new technologies, like if you adapt like CardioSignal, how that connects to the clinical workflow, what happens afterwards. Now these kind of worlds are a bit of isolated, and I think if we can combine and integrate better, like these things together, and I think design, what you were saying, has like a huge role in that, and it's kind of a small things, like when we've been doing the kind of risk detection, we tested in a way like how many seconds it takes to understand the risk situation of the patient, and in primary care, 30 seconds to understand the risk for chronic diseases. So we have these like design things that we can do to help to convey the information better, but we also need the integration part, like just to accept that maybe for the like the certain heart diseases, for example, it's the best way, the kind of the clinical workflow starts from home. But these are a bit of isolated worlds.
Yeah, I would say that somebody needs to do the heavy lifting. It's either the companies, developers, designers do it for the healthcare providers and for the patients and users so that they don't have to do it, or then you get more easily to bring out products that the users need to be doing more heavy lifting, and these processes need to be changed more. So it's a balance between those, and it's also this catch-up game that people, essentially everybody are lazy. It's just our nature. We want to get everything easily. So when things become more easy, it's already, like you said, those percentages have not changed over time. But if you look at how the world has changed, everything has gotten to some extent more easily. You have more services available more easily, but you also have more and more and more, which is bombarded toward you. So it's this catch-up game that at the same time when you're making stuff easily, you're able to adopt more services. That doesn't necessarily then after all help if the outcome is as complex as before. You just have more easy services than one complex service after that track.
Yeah. That's why I think this is also kind of the point with the integration, like more is not more, but the question is how does the entire workflow end to end gets better? Can you improve the entire workflow? Can you reduce the costs? Can you automate things? And like I said in the speech about the AI, a lot of unrealistic expectations. It's not like a silver bullet that you throw on top of the patient record system and then magic happens. It doesn't, because the workflow does not get better.
Yeah, one comment added to that again with the Apple experience, like all the mentality is simplify the hell out of it. Just simplify. Because you don't want to design it. It's one problem that a lot of the solutions are designed to fill the need of that 1 to 5% unhappy cases and missing the ease of use and adoption or adaptability of the 95% who would actually use it if that would be designed for them and not for that 1% that some doctor says that we need to serve that one as well.
Apple has been quite successful with this strategy.
maybe somebody could take some learnings.
Yeah, maybe something to learn.
But maybe if I once more little bit like zoom out and take it to the level of service design, not specifically product design, then I think that a really important thing to grasp about such a statistic, let's say adherence at 50% or so, or well, I've also heard this completely non-scientific, thing in medical school where whenever you prescribe something for a chronic condition, there's 1/3 probability that it will actually be used as you prescribed. And there's a lot of effort on thinking, what's the best medication, how exactly, what dose, what time of the day, is it in one piece or, half in the morning, half in the afternoons, that sort of stuff. Then the reality is that 1/3 will not take it at all, and 1/3 will take it somehow else than you prescribed. And I think this sort of averages out at 50% not taking their medication. And what I think is really important to also take into account when talking about such systemic changes is the people with the limited know-how, limited understanding, limited resources. Because it's not the highly educated, highly paid, healthy-looking person who is going to skip out their meds. So basically, it's the people who would need them the most who are most likely to fail at taking their medication. And I'm not saying fail as in the sense that it's a failure. I would say it's a failure of the system if you cannot convince a person to do things that help them. So like, obviously, every single intervention or every single test that requires extra effort or requires gear that you need to buy or requires the effort that you go somewhere you take tests. This is always more successful in the people who need it the least. So this is also really a system thing, and probably there will be some help coming from AI systems who can nudge people in the right direction, but there will still always be the people who don't have smart devices, who don't care about the stuff, and the system needs to also cater for those. So yeah, it's just a service design perspective.
Yeah, and actually, speaking of this, I also, if somebody hasn't seen it, there's a short film, you can find it on YouTube, it's called Uninvited Guests, and it's a perfect use case of having all kind of digital tech to improve your health, to have these reminders coming on, to have this stick to help you count the steps and what else not, and basically the person just does not want them in their life because they like the life they have, even though they have some health issues, but they prefer to stay in that comfort they have already. And I think we can also all agree that when we're talking about adoption, we're talking about basic human behavior, and human behavior change is one of the hardest things to do. And I will also now just one of the final questions for Ilze. I wanted to ask you, having been working more with hospitals and also governmental institutions, maybe there's anything specifically you have seen within their decision making, between the decision makers. What is some things that maybe are not helping to nurture the soul for innovation and adoption?
Yeah, I think the biggest problem in institutions is that they are working in the routine and they are not actually looking out of the box, and they are having those silos and working inside of their small teams. So I think the biggest challenge and biggest kind of suggestion for them is to actually open up and do as much as collaboration and outside of institutions, I would say, and invite service designers, invite specialists from different technologies to help them to look how they are working with different perspectives, what they are doing every day. I would say this is something what I see the most in any, it's not only in health, it's in kind of resistance of anything what is kind of strange or maybe disturbs and can disturb their routine work.
Yeah, thank you for that. And we're really short of time, but I will just ask the final round for each of you, just in one sentence. What's one thing, a principle, mindset, or action that could most increase the adoption of health innovation, if you had to put in one sentence?
Start by asking, why should they care?
Fair enough.
Yeah, I also think that the question, like, why should you change or why should you do adoption and why actually it is hard to adopt something, I think this is the biggest learning, and if you can answer the questions and maybe prove people that maybe it can help and change some things, if you change and adapt, then maybe it's the way how to change it. Just, yeah.
I would say this: removing the friction in your life, make it part of your life. Removing the friction in the processes in the healthcare, anywhere. Like, just find a way to remove the friction, and it will be adopted and used. Whenever you increase the friction, then you're out of the game eventually, and there will be churn.
Well, I think. To put it very short, so prevention is the only way to make healthcare better for everyone.
Thank you all with that, and we will open now the final 3 minutes for any questions from the audience. Please, let's try to keep it very short and concise. Everybody wants to go to lunch already? No questions? All right, then thank you very much to all of our speakers today. And let's all enjoy the final lunch and then come back to the final panel and the finalists on the pitching session as well and close up this conference.